Hello, everyone. I'm Marian Leary, Director of Innovation at Penn Nursing. Welcome to the third annual Penn Nursing and Penn Medicine Nursing Story Slam event, generously supported by Penn Nursing alum Sandy Sandberg and her husband Joe Sandberg. The theme for tonight's show is Stepping Up. Before I kick us off, our Dean of Penn Nursing, Dean Villarreal, would like to say a few words.
Thank you, Marian, and hello, everyone. I want to tell you this is one of my favorite events each year. As a nurse who has spent many years at the bedside, I can confidently tell you that nurses have the best stories. Stories of courage, of triumph, of sadness, and joy. As Marian mentioned, the theme of the stories tonight is stepping up. During 2020, the year of the nurse and midwife, and a year drastically changed by the COVID-19 pandemic, nurses have been stepping up in so many ways, and often in ways that the average person would not consider traditional or usual. Nurses have also played a critical role in social justice this year, which has intersected with the COVID pandemic. Penn Nursing's robust mission encourages us to challenge structural inequities as a way to achieve health equity. I know all of our speakers tonight embody our mission to be agents of change. Tonight, you will hear how nurses have indeed stepped up to make this world a better, safer place for everyone. I'd like to thank everyone who will come to this stage to share with us tonight. It takes incredible courage, but I expect nothing less from those on the front lines of healthcare. Please know that this virtual space is filled with love, support, and gratitude, not only for what you will do tonight, but what you do every day. Our storytellers are not the only ones who are stepping up for this great event. I'd like to extend my thanks to several others. First, for all of you, family and friends, for joining us tonight. For Person Arts for partnering with Penn Nursing for the Story Slam, as well as PWP Video. To the Penn Biomedical Library 3D Printing Lab for the wonderful 3D printed trophies for tonight's event. I'd like to thank Penn Medicine and specifically Kevin Mahoney, CEO of the University of Pennsylvania Health System. He certainly is a friend of nursing. And to my esteemed colleagues and partners, the chief nursing officers from Penn Medicine, Angela Coldonato, Barbara Pryor, Colleen Mattioni, Jim Bellinghoff, Elizabeth Craig, Jean Romano, Larry Strassner, Sandy Jose, Sheila Kempf, and of course, Marian Leary, Penn Nursing's Director of Innovation, for her leadership and creativity. And a special, again, thanks to our Penn alum, Sandy Sandberg, and her husband who have supported us. As I mentioned last year, the World Health Organization designated 2020 the year of the nurse and midwife. They couldn't have known that the pandemic would thrust our work into focus so acutely. And so we're going to continue the celebration into 2021. I urge you to stay connected to Penn Nursing via our website and newsletters to find out more about our upcoming events as we continue to celebrate. But tonight, I hope you will enjoy the third annual Story Slam. I know I will. Thanks once again. Marian?
Thank you, Dean Tony. Like the Dean mentioned, this year between last year's Story Slam and this one is like nothing we could have ever imagined. With the fight for social justice and health equity, along with the coronavirus pandemic, nurses really have been stepping up in more ways than one. And tonight you will hear 7 stories from Penn Medicine nurses and Penn Nursing that epitomize that work. Our storytellers have worked tirelessly over the past 6 weeks on their stories with our collaborator, First Person Arts. First Person Arts is a Philadelphia nonprofit that celebrates the power of the personal. Tonight's Story Slam is a storytelling event, not a competition, as all of our nurses are winners for sharing their stories with us. And as such, they will all receive these nifty 3D printed microphone trophies thanks to the Penn Biomedical Library's 3D Printing Lab. I want to thank all of our storytellers for sharing their true personal stories, and I know you're all going to do amazing tonight. And believe me, to those out there in the audience, their stories are going to make you laugh, and they are definitely going to make you cry, so go make sure to grab some tissues and get set for a great event. I'd just like to do one more shout out. I want to personally thank one other nurse storyteller, Meg Vance, who will not be performing her story tonight, but was kind enough to be an alternate in case someone was unable to perform. She worked hard with us over these past 6 weeks as well. So Meg, I just want to say thank you. And with that, I'd like to invite up my friend and colleague, Neil Bardhan from First Person Arts, who will be emceeing the event tonight.
Hi, Marion. It's so great to see you, as always, and thank you so much for bringing us on again. I'm the Director of Applied Storytelling at First Person Arts, and I have been lucky enough to work with Marion over the past several years, and Marion, as well as the rest of the Penn nursing team, to bring these events to life. I've met dozens of Penn nursing and Penn nursing related folk through these events, and we're just honored and touched to continue this collaboration. So thank you to everybody. And on a personal note, I can also say that what brought me to the world of storytelling was actually an interest in science communication and helping people understand the science in their lives, whether it's health sciences or other. And so this event is very near and dear to my heart. And Marion's got a great point. Get those tissues ready, because this is an event that I cry at every single year. On a lighter note, if you are in the Zoom chat, please make sure that you're setting yourself to sending chats to panelists and attendees. And while you're checking that, tell us where in the world that you are watching from. We'll be excited to engage with you there. Now, our first storyteller gets to kick things off, Wanda Lavelle McCall from Pennsylvania Hospital. And Wanda tells me that one of her guilty pleasures in life is Gary Vee's inspirational quotes. I'm not quite sure how inspirational quotes can count as a guilty pleasure, but I love it. Wanda, thanks so much. Take it away.
Hey, everybody. Well, Gary Vee is really raw, and so that's why he's my guilty pleasure. So, hello, everybody. Let's talk. 2020. Wow. Right? You know, fear has an overwhelming way of making you stop, making you freeze for seconds, for minutes, for hours, and you don't know what to do. That was me, April of 2020. As the masks went up on face after face in my neighborhood, at my Wawa, even along the walking trail of Cooper River, I couldn't help but feel that there was something insidious trying to choke the best in me, trying to choke my thoughts, my words, my breath, my voice, my impact. And I didn't know what to do. I would enter the critical care unit and I could see the fear in my peers' eyes. We didn't know what was coming or how to handle it. And most days we were silent on how to cope with what we were beginning to see in critical care. COVID. It was obtrusive and it was everywhere. It was everywhere. It stopped the world. It stopped your world. It stopped my world. And the experts, with no knowledge, frozen, with a lack of direction, had no way to make it stop. So, shuddering at the thought that there were no answers, I often would run home, absolutely no traffic, right? I would jump into my bed, turn off the phone, and pull the comforter up over my head, just looking for a moment of warmth. And it was short-lived. It was short-lived. I was wondering, where would I find the answers? What would I tell my family? What would I tell my church members? Or what would I say to my girls, one in Philadelphia and one in Boston, as I quietly contemplated sending them an N95 in the mail? I needed something to click. I needed something to happen because we were frozen. And I didn't know how to recapture my voice, recapture my impact. I remember the calls, Wanda, will this sock work? Or Wanda, is hand washing really enough? Or better yet, hey, Wanda, you find any Lysol today? The people needed me. And I know that they needed you. I tried to figure out, what could I do? I had to shake myself and shift my gaze and take my eyes out of the headlights and kind of just get moving. What was I to say? How was I going to help the people get their power back? Then it clicked for me. I was going to use what I had been learning in my spare time. It was a hobby. It was a guilty pleasure as well, I guess. And I started to think about how I could help empower the people so that they could recapture their voice. They could enjoy what they value. They could talk. They could laugh. They could touch deeply. They could sing again. So, time to pick up the phone and fire up the laptop. I thought, hey, maybe we could talk about how to stay well mentally, immunity, how to create self-care practices that built up our resilience. And I could share those things. And what happened was I started to see a doorway to help people who felt frozen, felt locked out, begin to embrace the fact that they had a voice and they had power. So what did we do? I thought about using Zooms. I was using digital platforms, live streaming, webinars to begin to teach people how to gain their voice back. And I wanted to go beyond COVID care and quarantine. We did talk about how to properly use masks. We used webinars to teach our young people, this was a great one, on how to bling out their lashes, put on eyeshadow, and girl, don't worry about the lip gloss, because that bedazzled face covering, it was going to wipe it all away. Before I knew it, people were lighting up and they were warming up to the fact that they were creative. I was watching seniors in my church learn how to create image quotes. I remember empowering a single mom who was a teacher on how to create digital products so that she could take her teaching beyond the four walls of a brick and mortar classroom and learn how to create more income for her family. And then guess what? It was Nana's time to finally solidify her selfie game. It was amazing. And we were moving. And so, with starting with something as simple as how to wear a mask, hand washing, what to do with your clothes, we started to grow beyond that. We started to make impact in the lives of the people in our church community. And people began to discover that they were not frozen. They were not confined. And they were greater than the darkness that COVID had plunged us all in. The French artist, Henri Matisse, says that creativity is another word for courage. And I firmly believe that whenever fear is present, we have an opportunity to step into our courage. Courage is the ability for us to move past our comfort zone. And boy, were we completely uncomfortable. This was all new, all unknown. But it's also the ability to transcend, ascend above our fears. So, I never thought that I would say this right now, but 2020 Wow, right? Thank you. I want you tonight, as you watch our stories, to reflect on what you learned this year. 2020, thank you. 2021, here we come.
Thank you so much, Wanda. That was such a great way to kick this off. I love so much about this. Question for you: what's something that like really surprised you about those Zoom webinars that you were holding?
Well, the funny thing was that I didn't realize how engaged the seniors in our church would be. Like they would get on the Zoom webinars and they would go, "Can you see me? Can you hear me?" And they would have their hair together. They would be prepared to talk and share. And they would just kind of blossom. There were people who were storytellers, people who just really came into their own and had specific things that they could teach and share. And they were learning. They were actually increasing their health literacy as well too. So that was awesome.
Love that. Thanks again for kicking things off, Wanda. Looking forward to connecting with you more about this in the future. And our next storyteller comes to us from Lancaster General Hospital. She enjoys a good trip to Goodwill, and she is Hope Adkins Durante. Take it away, Hope.
Number 3. I want you to remember that number as I tell my story. It was April of 2020 when I was working as an RN on an outpatient observation unit. And I got a message on a Friday night that I would be, I guess, meant to go to the COVID unit or transfer to the COVID unit for that weekend. And I thought about that call to rise long before I received that message. You know, COVID-19 was in, the news. It was a news staple, as was the sentiment that healthcare heroes on the front lines were heroes. That word, heroes, it weighed so heavy on my shoulders, yet I wanted to rise to that ideal, but I was so scared. But I realized that fear and love are one and the same. They can either bend you and make you weak, or they can make you strong and move you forward. I chose the latter. Number 3. I walked through the anteroom, the air-controlled anteroom, onto the COVID unit, and I found myself surrounded by a sea of seal blue nursing scrubs. I was greeted kindly and escorted off and shown where to put on my own scrubs and where to get my own PPE. And soon I returned to that sea as a piece of it rather than just an onlooker. Number 3. I got my patient assignment and I realized very quickly one-to-one patient care on a COVID floor takes a lot of time. I would spend an hour or more in a patient's room before I would find myself in the hallway again. And one time I came out in the hallway and I saw a small cluster of nurses talking, and I knew immediately what they were talking about. Someone was dying on the other side of that hall of COVID-19. So I listened and I watched. I was drawn to that dance, the dance I think every nurse knows. When that last song is played, we move silently and we move intentionally, all taking a turn. And I saw one sea of blue hero replacing another in and out of that room. And I just kept watch. I returned to my task, but I never lost sight of that room on the other side of the hall. I guess I was waiting for my turn. I was waiting for my turn to join that dance. When that patient's nurse, the primary nurse, actually got an admission, I noticed that and I thought, this is my time. So I put on my PPE and I put on my protective gear and I opened that door and I shut it behind me. And I remember looking at the door before I turned to see the man in the bed. And I could tell he was struggling to breathe as the sheet rose because his lungs and his stomach were pushing forward in a way that was not natural, wasn't how you and I breathe. He was struggling. And I went down, I grabbed a chair, and I sat down beside him. And I remember brushing his hair across his forehead. I looked at his name band, only remembering his first name. And I held his hand. And I said the Lord's Prayer. I think I made small talk with him. I asked him if he had pets, and I knew he couldn't respond to me, but I know hearing is the last sense to go. So I spoke to him like I would speak to someone I loved. I told him I was there, and I think I sat for a long time before I finally said to him, I'm so sorry. I'm so sorry. I can't fix this. I was so sorry that he had to meet God in this sterile room. But I told him I was here and that when he saw that light, he should go towards it. So I took my turn. I came out and I went about the tasks that I had left. But that it changed me. I think it changed me for a lot of reasons. But I bought a newspaper every single day that week, and I thought, I need to find this man. I need to know, who did he love? Did he have family? Where did he go to school? I needed to know more. And after a week of buying newspapers, I ran into his primary nurse, and I said to her, I said, I didn't see so-and-so's obituary. And I was wondering why. And she looked at me, and she said, well, he's a ward of the state. He's from a nursing home. So I knew he was from a nursing home, and being a ward of a state essentially means that family either cannot provide care or care was taken from them, so it was relinquished to the state. So he wouldn't have an obituary. He wouldn't have a funeral. He wouldn't have any of the things we would want for someone we cared about. And it was heartbreaking. So I wrote about that, and I posted it on social media. I'm a writer, so it's just natural for me to just put down all my feelings. And a professor that I had in nursing school saw it, and together we put together an article because she loved what I wrote and it inspired her. And we were published in Nursing 2020 in the December issue. And it just caught on like wildfire. All of a sudden, I told somebody at work, and all of a sudden my CNO knows, and now my CEO is reading what I wrote about that patient at an open board meeting. And I thought, this is incredible. And then I get a phone call from a local newscaster from a local station asking if she could meet me. She wanted to talk to me about what I had written about this man. And in that moment, I realized all of this. It was done intentionally. I was meant to enter that room. I was meant to sit at that man's bedside because maybe God wanted him to be remembered. And although I will remember him forever, everybody I've shared his story with, it goes on and on and on. So now he will be remembered, hopefully as long as he's worthy of. In April of 2020, a man died of COVID-19. He died in room number 3, and his name was Keith.
Okay, Greg. Thank you so much, Hope. Thank you for sharing this.
Thank you. Yeah, thank you for letting me share it. I appreciate it.
It's been such an honor to work with you on this. Have you been inspired to write about other patients over the years, or is this a first?
I write about yes, I do write about patients all the time. Not using their name, not using the situation, but
Sure.
it's an outlet. And if somebody can learn something from what I write, great. I think that's what I'm put here to do outside of nursing. But this in particular, it changed everything. I think, especially because he is a nursing home patient. He didn't get the recognition that I wanted him to, but now he did. And everybody hearing my story tonight is just just icing on the cake. Yeah, it's great.
Perfect. Thank you so much, Hope. Really,
Thanks so
really
much.
appreciate your taking the time and care to provide him this legacy.
Yeah, absolutely.
Our next storyteller comes to us from the University of Pennsylvania School of Nursing, where she's a graduate student. Something she loves is bubbly water in various forms. Stacy Bevan, please take it away.
Nursing is, at its foundation, about creating space for others. This is even more true for those that have little space of their own. Let me explain with the breath. Please, everyone, take a big inhale and exhale with me. Let's do that again. Inhale in and exhale out. On the inhale, the diaphragm contracts, straightening and putting pressure on the abdomen. The muscles in the torso lift and expand the chest by spraying the ribs outward. As the pressure inside the lungs changes, the air rushes to the space that was created. This air provides our body with oxygen in exchange for carbon dioxide and nurtures us. Inhale in, exhale out. The diaphragm relaxes, shrinking towards the center. The muscles in the chest begin to recoil from their stretched state as the pressure in the torso rises, pushing air out once again. The heart rate slows, decreasing the blood flow to the lungs as the pressure forces air out through the nostrils. This decreased heart rate, in sync with the breath, signals to the brain to slow regions responsible for flight or fright response and releases calming endorphins. The space that's created in the lung changes spaces in the brain. One last time, inhale and exhale. I felt the cold, wet gel hit my hands as I took an inhale in. Inhale in confidence, I said to myself. As I rubbed the sanitizer in circular motions around my hands, I breathed out. Exhale, kindness. This had become a sort of mantra of mine as I walked into a patient room, never knowing exactly what I would encounter on the other side of the door. As I heard a loud noise from down the hallway, I quickly pressed my palm into the wall dispenser once again, sensing I needed an extra dose of confidence for what I might find this time. I shuffled a few seconds behind the behavioral health techs, who were already attending to the child who was screaming outside of the day room. Before I could glance in their direction, I encountered a second child. He was small, the sort of small you wanted to pick up, throw over your shoulders, and watch as he delightfully giggled. In this moment, however, I was noticing how small he seemed in this hospital. Its white, sterile halls contrasted against his ebony skin. He had big brown eyes that burrowed inquisitively into whatever was around him, which, at this particular moment, happened to be me. Another loud noise echoed across those walls as the curiosity began to morph into fear and then distress. I had been floated to this unit, and I didn't know what might work for him as he was on the edge of sensory overload. The distress began to move from his eyes into his forehead as his eyebrows scrunched towards the center of his face. I took an inhale in and exhale out instinctively, and to my surprise, so did he. So I took another big breath in and out, and he imitated me that time too. We kept going, breath after breath. In the back of my head, I had already developed an escalation plan, his medications for agitation, reviewing therapeutic holds. But thankfully, the breath work was enough this time. His eyebrows returned to their normal position and the deep curiosity back to his eyes. On the next exhale, his hands pounced towards the sides of his face as he let out a small roar. He was, after all, not even 5 years old. Who taught you this? I asked. Oh, the last time I was here, he said. Breathing, kicking a ball, running back and forth. These are my coping strategies when I'm upset. But sometimes, he said with his eyes downcast, they don't work for me if I'm at home and it's too loud. Sometimes there's just not enough space for me. That last part made me gasp a little bit. My 5-year-old patient had so articulately described a nursing diagnosis, a clinical intervention, and a barrier to implementing it. The wisdom coming out of his little body defied what I could have expected developmentally for a child his age. I later learned that this patient lived in a 1-bedroom apartment with a handful of other siblings, and he had been in the hospital for over a month, not able to return to his family. At this stage, it was unclear if it would be a safe discharge plan for him. The intergenerational trauma that he and his family had endured was profound. This child, like so many others that I help treat in inpatient psychiatry, is breathing in systems and spaces that are actively designed against them. But while the world continues on its slow but persistent arc of justice, I'll never forget this child's insight, resilience, capacity for wonder, in spite of these obstacles. All he needed was a little bit of space. And he caught his breath in that moment. So I invite you to notice what's around you. And on this next inhale in and exhale out, take note of how much space you have. Nursing is about creating space for others, and we all have the opportunity to be in the same air as someone else, perhaps increasing their capacity for breath and space in their body and in the world. Thank you.
Stacy, thank you so much. Is that a technique that you've used with others as well, just simply breathing?
Yeah, it's something that that was the first time that I had tried that, and it was sort of on accident. And so he responded so well that it is something that I've used in the past for other patients. I am also a yoga teacher, and so I often will teach yoga with patients as part of a group activity in an inpatient psych setting.
Perfect. It all comes together for you then.
Yeah.
All right. Thank you so much, Stacy. And folks, I know there have been some challenges signing on to view the Zoom. Just a heads up, we're working on fixing that, and more people are getting in now, and we'll be recording this and being able to share that later on with you all. So things are moving along in that regard. While I'm thinking about where everybody is, apparently we have folks watching from Colorado, San Francisco, Indiana, Michigan. This is incredible to see, and speaks to the power of these nurses' stories, is that people all over want to hear them. So very excited for that. Our next storyteller is an alum of the Penn School of Nursing and is at the nursing department at Penn Medicine. It's somebody who's a big fan of cookie dough. Heidi Davis, take it away.
Thank you so much, Neil. Hello, my friends. I feel very confident calling all of you friends because we just made it through a very difficult year. For nurses and non-nurses alike, we have witnessed horrors, we have experienced loss of many kinds. And in that sense, we are bound together through that process. So I do think it's safe to call you friends. And interestingly, tonight, my story is about treating those who are bound up. Yes, my story is about enemas. So when people say it takes a special kind of person to be a nurse, this is exactly the kind of stuff that they're talking about. And having just survived the shitstorm called 2020, I know you can brave the next few minutes with me. So go with me now, and I promise you'll be glad you did. In the trenches, as a novice nurse, I had an altogether different kind of education than I had had in my undergraduate or even graduate studies. Learning how to carry out a skill in the order of a checklist feels very different in the classroom on a mannequin than it does in the real world in a healthcare environment on a real human being, especially if that skill involves forcing liquid into the rectum. It is this kind of in-the-field learning that is full of feedback of all kinds that produces really good stories. One of my best friends defines feedback as pain leaving the body. And if we're humble enough, we can say thank you to feedback and see it as a gift. And we can bring the treasures with us into the future. We can have gratitude for growth and growth with gratitude. So let me take you to the very beginning of my nursing career, which started working in the emergency department at a top pediatric facility, where I realized that despite all of the hard work to date, I was still very much on the edge of a precipice. I was an eager 21-year-old who had just passed the boards, the NCLEX licensure exam, and now I was responsible for making assessments and performing interventions on the tiniest babies up through adolescence, and often in the very critical audience of their parents. I would wear my long brown hair tied up. I wore scrubs with Curious George and Dr. Seuss printed on them, and I had a brand new black stethoscope around my neck. So in this particular day, I was walking a patient back from the emergency room waiting room, and this sweet patient had very, very short black hair, round cheeks, and an oversized protuberant belly. I would have bet my first paycheck that this little guy had never consumed a vegetable in his entire 7 years on planet Earth, and that might have been of no consequence until today. Within 1 hour, the abdominal x-ray confirmed that this kid was in fact FOS, full of stool, and it confirmed what I had suspected all along, that he had an S-shaped brick of like amalgamated chicken McNuggets and French fries at the tip of his colon, making him very uncomfortable. This little guy won himself the famed milk and molasses enema, which was a common remedy in that ER for constipated kids. Large volumes of fecal matter mixed with everyday kitchen items was not something that I had prepared for on the NCLEX, I can tell you that for sure. As a new nurse, I was understandably very concerned and focused on doing this task in order and correctly. So I had to learn things like how to microwave the milk and for how long, how to pour the molasses into the enema bag so it didn't get all over the counter. I had to learn how to explain to kids of varying ages why it was okay this time to put something in their bottom on purpose, when otherwise that was a big no-no, and we frequently taught kids that in the ER. I had to teach these anxious parents what to expect in the moments that followed. But still, even if I had done all of that perfectly, I had to think even more proactively if we were all going to go home wearing the clothes we were currently wearing. So what wasn't on the skills checklist was the great idea of putting an out of order sign on the restroom down the hall so that it would be reserved for my enema kid, my little patient. It was also important then to make sure to tell the parents that the restroom wasn't actually out of order. That was just my secret way of reserving it. I learned how to make a makeshift diaper out of Chuck's pads, those little blue rectangular underpads, so that Hansel or Gretel didn't leave a little splotchy trail down the hallway to that reserved restroom. And I had prepared all of this that day for my adorable patient, and it was time to administer. And I could tell this kid was a fighter. And I mean, good for him. Honestly, we want kids to put up a fight if something invasive is happening to their body. That is an adaptive skill. So preparing for kicking legs and flailing arms, I asked the tech that was in the hallway to just come in and lend me an extra set of hands. And just weeks prior, I had been the tech. I was the second set of hands, but now I was responsible for actually administering this famed milk and molasses enema. So I went into the room, thanked the tech for their assistance, set everything up, gave a calm explanation to the patient and the parents about what was going to happen. I put on my gloves. The tech restrained the little guy's leg so I didn't get kicked, and I gently inserted the tip of the enema tubing and released the clamp. And the volume line on the enema bag slowly dropped, infusing and softening up that brick. And then it stopped. The line completely stopped falling, with still much volume yet to be infused. So I bent down to see if maybe the tube had kinked or if the tip was blocked somehow. And then I got some feedback. To say I had egg on my face, that would have been a treat. No, feedback that day was not pain leaving my body, Stephen, but rather feedback was warm, sticky, smelly sludge leaving his body and making its way onto mine. Oh, I had performed that skill correctly, all right, and achieved the results that we were aiming for. His aim was so good. I didn't even see it coming because honestly, the feedback was already covering my eyes. So what do we say to feedback? Thank you. Gratitude for growth, growth with gratitude. I wish face shield had become like such a commonplace part of PPE back then. I did learn to bring goggles in when I was setting up the room in the future. Long after leaving that job, I learned that I could also put an out of order sign on a restroom in times of need for myself. For instance, if I was about to have a crucial conversation in the workplace, I might do well to slap a sign on the restroom door because afterwards I very well might need to go in, close that door, and lose my composure for a few minutes. I also learned to bring a notepad with me into the restroom because what was coming out was material to share, which might even make a good story one day. Thank you.
Thank you so much, Heidi. I love that detail about putting the sign on the bathroom. And I have to ask, did you discover that on your own or pick it up from somebody? How did that come to be?
I did pick it up. I did a lot of watching and took a lot of notes as a new nurse. In fact, I had the nickname the girl with the clipboard because I had a clipboard and I was taking notes for everything. And yes, I learned that from a very wise nurse and thought, okay, of all things, that's not something to forget.
No, that's a good one. And again, that's not going to be on the licensing exam, I figure.
It sure wasn't. No, exactly. But when I teach clinical, I am sure to bring that point up.
Perfect. All right. Thanks so much, Heidi.
Thank you.
Our next storyteller has years of experience in all different ways in the nursing world. She loves a good cinnamon bun, apparently. Kathleen Brown, looking forward to hearing your story. Take it away.
Thank you. Hello, I am Kathleen Brown, celebrating my 50th year in nursing. My story is about the middle of my career, my 20 years as a women's health nurse practitioner working in an office with 3 obstetrician gynecologists. Many of our patients are memorable, but I want to tell you about one particular woman. We met during an evening office session with me as the only provider. I had 3 support staff working with me that evening. While moving from one examination room to another, I saw a woman standing in the waiting room. This is very unusual. People always sit. I'd never seen standing and waiting before. She's a beautiful woman with lovely dark hair cut expertly into a bob, and she's wearing an eye-catching, very pretty suit. She was also overweight. Weight to the point none of our waiting room chairs could accommodate her girth. Her pretty face looked anxious, but that's not at all unusual. When you make an appointment with someone new, it creates anxiety in absolutely anybody. I completed an exam, then approached my new patient. My routine was taking each new patient to my office for an introductory chat, but I could not in this case because my office chairs are the same as the waiting room chairs. I took my patient directly to an examination room. After I closed the door, I heard staff giggling. I assume about my new patient. If I heard it, she did also. My first thought was, this is not okay, followed by a quick thought of, what do I do now? Racing through my head was the idea that she had been hearing giggling or worse from many other people in her life. What should I say and do? What would she like me to say and do? I believe I felt just as anxious as she was at that point in time. This patient was knocking on a door I had never opened. She was knocking on a door that required skills I feared I did not have. What came to mind, along with the fear, was a realization that I had to relieve her anxiety and mine and start building trust. If I fail, this visit will fail, and I would never see this patient again. I wouldn't be nursing helpful, and I must be nursing helpful. Suddenly, crashing into all my worries and doubts was an answer. Treat her as you treat any patient. Treat her with respect and kindness. Actively listen and be your compassionate nursing self. The exam table was our first barrier. I feared if this patient sat on the tail end of the table, the head end would rise up from the floor. She could slip, and the table head might hit her head. So I told her about my fear and explained a need for me to lie across the top of the table as a counterweight. She smiled at my description of the potential problem plus proposed solution, and from there we developed a "we are in this together" mode, led by her comedic description of what was happening. Together we fine-tuned the plan, and now the giggling was ours. Our method worked, and she was safely seated at last with both of us smiling. I sat on my stool, moved closer to her with new confidence. Now seated, my new patient revealed she'd made this appointment to discuss contraception. That's a very comfortable topic for me. I presented options. She chose one. I did a brief exam, noting she had elevated blood pressure. During this first visit, I noticed that she has a great sense of humor. She has excellent verbal skills and large affection for her partner. Her face absolutely lit up when she was talking about him. One of the things she said about him is he understands. He understands was said in a way that I should understand what she meant, but I did not. I filed the phrase away in my head and held it until our next meeting. She left with a referral for further investigation of her elevated blood pressure and an appointment to return to my office in 2 months for a check on how the contraceptive method she had chosen was working. In 2 months, she returned with her partner. He's a slight man, short in stature, and light in weight. He understands became clearer. Perhaps he too had experienced giggling, and worse, about his short stature and weight. The outstanding feature I noticed about him was that he had a huge smile that went all the way up into his eyes. His smile encourages a smile from anyone who sees it. During this second visit, my patient revealed her contraceptive method was working well for both of them. They were pleased. They had a few questions that were easy to answer, and their affection for each other was very apparent and a pleasure to witness. A couple years later, this lovely patient made an appointment to discuss pregnancy. Both she and her partner felt they were ready for a baby. For the sake of her health, I recommended weight loss before pregnancy in order to reduce the physical risks to her. Simply put, becoming pregnant would be less risky if she weighed less. With lots of encouragement from her partner and her family, she lost all the excess weight in less than 2 years. My small contribution was encouraging her on the telephone on occasion. Her partner and her parents did all the work of assisting. After the weight loss, she became pregnant. I had the pleasure of providing prenatal care. Her pregnancy was uneventful. She delivered a healthy baby girl with no complications. Mom and baby went home safe and healthy. There were several more visits with this delightful woman before I left my practice. Her husband remained affable and his smile remained contagious. Her sense of humor became more pronounced, which was helpful in caring for a new baby, as anyone who's brought home a new baby knows. One patient out of many changed my office routine, prompted a change in furniture. Support staff learned how to giggle with our patients, not behind closed doors. This woman also changed my level of understanding about weight and weight loss. And perhaps most importantly, she changed my use of words. She enhanced the attention I pay to what I say and how I say it. The patient in this story helped me be a better nurse, and I believe a better person.
Thank you so much. Really love this story, as you know, and it's amazing what getting in situations that just kind of stretch our imagination and understanding can do for us in the short and long term. You used a phrase that I'm curious if it's an invention of yours or something more widely used, which is nursing helpful.
It's something I need to do with every interaction with a patient. I need to feel like I leave that interaction and I've done something to help this person, assist this person, whatever word you like. I think it's a bottom line for many, many.
Super. I love that. I'm gonna bring that with me in the future. So great. Thanks again, Kathleen. And our next storyteller of the evening comes to us from she's a Penn School of Nursing alum, and she tells me that her alpaca is the light of her life. Amy Edgar, take it away, please.
Thanks, Neil. I'm really grateful to be here tonight, and I'm also very grateful for the stories that came before me. In some ways, laughing and crying and kind of feeling all those emotions really prepared me to tell you about mine. This story actually spans decades. So for me, it starts in the 1970s. I grew up in the South, in a part of the South that was the country. My family, extended family, were farmers. There was a great deal of a sense of community, and it was a kind of an idyllic place to grow up. The other side of growing up in the South in the 1970s was that there was also this level of programming that was happening. And even though I didn't understand, I didn't have words for it as a child, I knew that there was something about it that was really not okay. One of the things that was true in my childhood is that I'm a very empathic person, and that was true when I was little. And so even when I didn't understand what was happening, a lot of times I remember feeling pain and not knowing why. One of the truths of my experience as a child in the South is that there was overt privilege and overt acceptance of prejudice and racism and all the isms. And I don't believe that human beings are born with this. And I do believe that it was something that was transmitted or taught to children, even me. So in my world in the 1970s, in a small southern town, people of color lived in a place called the Hill. And so there were lots of stories and jokes about what happened over on the Hill. Black and brown folks, yellow folks, red people, they all had names and they were really ugly. It was not nice. My dad's favorite candy from my childhood was a candy that was called the N-word, toes. Think about that for a minute. That was my dad's favorite candy. I knew that this was wrong. I knew that there was something really deeply hurtful and unjust. I also didn't know what to call it. I was a child, and so I spent all of my early years really just waiting to get out. Eventually I did. I came to Pennsylvania, and believe it or not, I hit Philadelphia, and it felt like the first time that I could breathe. You know, walking around in the different neighborhoods in Philadelphia, it was a magical place for me. People of all walks of life, shapes and sizes, colors, clothing, culture, languages. It was a bazaar of humanity. Bazaar, like, you know, where you go find cool things, not like weird. And so I immersed myself in the culture and multiculturalism that I came to find in Philadelphia. It wasn't perfect. And of course, there was still racism and prejudice, and social justice was not extended to everyone. And it was better. And I could finally find the words to describe the pain that I had been feeling my whole life growing up. Flash forward 27 years. So we're now in the early 20s, mid 20s. I've been in Pennsylvania for a long time, 27 years. I have gotten really comfortable. I created my own practice. I take care of children with behavioral health issues, created a wonderful team. We do amazing work, helping kids find success, be happy and healthy. In this practice, we had really convinced ourselves that we were just, that we were aware, that we were owning our privilege, and we had a sense that we had done all the things right. And I have to say, I know now the naivete of that. I can recognize now how much my privilege still informed our thinking even then, even when we were trying. That became really apparent for me on a particular day in 2016. That would have been November 5th, and it was the day after the election. I wasn't sure what this meant for the world. I had a lot of concerns. I had worries about all of the isms, including racism, and what this meant for my children, the children that I take care of at the practice, what this meant for my team, what did this mean for my family, what did this mean for healthcare, what does this mean for this country? And so I walked into my office that day. It was chilly. I think the heat had not fully engaged at that point, so it was chilly. I was tense. I was just feeling off. And the first child that I saw with his dad was a 10-year-old little boy, white boy, who said to me, we had a great relationship. I'd been providing care for him for a while. And he said to me, Miss Amy, we won. White people won. White people won. I almost cried. I could cry now. That didn't come from inside of him. He wasn't born to this earth understanding or knowing what that meant. And I had taken care of this child for 4 years, and he's so sweet and so empathic and such a wonderful human being. And in that moment, I thought I was going to cry, throw up. I don't know. There were many things that flashed through my head. And I wasn't ready. So the best I could do in that moment was say, you know what, buddy? I am happiness when human beings win, when all human beings win. And I'd really like to talk to you about that sometime. And that was the best I had in the moment. So I kept walking towards my office and kind of straightened my shoulders and said, okay, what's next? And as I walked in to my office, there was a little girl sitting in a chair outside my office crying. This was another child that I had been taking care of for a while, knew well, and had a great working relationship with. So I said, I stopped and said, are you okay? What's going on? And she said, this little girl who was 7 years old, who had brown skin, whose parents came here from Mexico legally to find a life for their family. She said to me, Miss Amy, someone said at school that I have to go back to Mexico now. They asked me if my mom and dad were going to be taken away. And so I had, all 30 seconds to recover from the first one. And here I am being, asked to reframe for this little girl something that was potentially really horrible. And I did not have answers. I wanted to say to her, honey, of course it's going to be okay. Of course your mommy and daddy are going to be fine. Of course you're not going to have to go back anywhere. You belong here. And there was a part of me that wasn't sure, even then in 2016. So we all know what came after. We all know what the year 2020 brought, and the culmination of all the fear and all the rage and the frustration and the dismay. You know, it all bubbled up in the summer of 2020. My team works very hard every day to hold our space, that includes where we come from, who we are, what we have, and what we don't have. And we are really committed to continuing an ongoing understanding, deep understanding of what that means for us and for the children and families that we interact with, that we work with. What we did in 2020 was really ask ourselves some hard questions about, you know, what don't we get? What's missing? Where does our privilege blind us? What do we assume? And how do we help our kids? The change that we all committed to is really what we stepped into together. Which is that I don't have solutions. We don't have solutions for systemic racism, for injustice, for the burden that so many people in this country carry as a result of just who they are, how they were born, their DNA. I don't have answers for that. So all I can tell you is that we made a commitment in 2020 to step into our work with awareness, with intention, to open the hearts and minds of the families that we engage with in any way that we can, to be there authentically. And while we may not ever be able to change millions of humans, we take our work very seriously, one child, one family at a time. Thank you.
Thanks so much, Amy. I feel like a lot of us have had some eye-opening experiences over the past couple of years about where we could be having conversations differently. This is maybe a strange question, but if you could go back to the Amy that one morning and give her a pep talk before she started her day, what would you say to yourself?
Yeah, you know, I think that I would just give that Amy a hug. That Amy was hurting too, in the sense that that Amy worried about humans, and so walking into that was both brave and also really overwhelming. So I would just give her a hug and say, "Hey, you'll figure this out. We do it all. You do this every day. You figure it out, and we'll do it together."
Right. Yeah, that was an excellent thread that you kind of shared all the way through. As you just kind of keep revisiting, keep re-examining. So, thanks again, Amy. Really, really appreciate this perspective. Our final storyteller of the evening is Wendy Palma. From the Hospital of the University of Pennsylvania, and Wendy's spoken at magnet conferences and also enjoys watching The Bachelor, like me. Wendy, take it away.
Hi. 2020, it was the year of the nurse. This was also the year the public saw how nurses always step up. I experienced this in my own practice, but most impactfully when I was deployed to the COVID ICU last spring. It all started last February when my mom called me one day And she asked me, "Have you heard of the coronavirus?" "Yeah, Mom. Patients come in with it all the time. It's like the common cold." Her response, "Are you sure?" "Yeah, you must have it mixed up with something else." Well, guess what? She didn't. I mean, when isn't my mom always right? The first week of March, our first novel coronavirus landed on our unit. This was not the normal coronavirus we see. The fear and anxiety on our unit was unparalleled. I could feel my heart race at the unknown, and the sweat on my palms, it spread throughout my entire body. This time I knew it wasn't the side effects from menopause, but the unanswered questions and the unknown risks. Our first patient was admitted into a specialized isolation room, and we had in-services on how to dress in our special isolation gear. You know, that gear that resembled spacesuits? Within weeks, Pennsylvania was in a lockdown. And New York, it had become an epicenter just hours away. A worldwide pandemic sounds so huge, so big, right? It was affecting individuals without discrimination, as I soon found out when I arrived to one of my shifts in the middle of March. A newly admitted patient was in bed 8. I was told in report he was a middle-aged male with no past medical history. Let me repeat, no past medical history. But what I didn't realize was the connection I had with this very patient. So I got my isolation spacesuit gear on and entered room 8. And laying in the bed, attached to a ventilator, hooked up to multiple IV pumps, was not just any patient. This was my physician, my OBGYN. But so much more than that. He was the one who talked me off the ledge and held my hand through my surprise high-risk pregnancy due to paternal age. He was the one who would listen, validate, and squeeze me into his schedule every time I found a lump and thought I must be dying, because what nurse doesn't automatically think the worst? He was the doctor that would call to check on me after procedures, even if it was later in the evening. Why? Because he cared. He had cared for me during some of the scariest moments in my life, and now I would be caring for him. This pandemic had now become personal. By April, the population of COVID patients needing ICU care overwhelmed our unit, and it created a strain on our staffing. So other specialized ICU nurses across the hospital were being sent to care for these patients alongside of us. The catch was, ready for this? They were specialized in neurology, cardiology, and surgery, not pulmonary critical care. It was time to form a plan. Let me ask you this. Has anyone ever been skydiving? Anyone? Well, I did last year. Yes, in April 2020, I went skydiving. I mean, why not? It was the year of the nurse, right? It may have been metaphorically, but it felt legit real. Let me reassure you, skydiving isn't just about jumping out of planes. Nope, you have to know at what altitude to open your parachute at in order to glide to a safe landing. Now, I want you to picture for a moment the MICU team of nurses that I work with as professional skydiving coaches last spring in the COVID ICU. We were tandem to other specialized ICU nurses, provided guidance and support from takeoff at admission and landing at discharge and everything in between. After all, if you don't know when to release your parachute, it could be fatal. This is at least how I imagined myself last spring. Strapping myself as the expert onto colleagues from other units, guiding them through protocols related to paralytics, sedation, and proning, and supporting them until they felt confident to jump out of that plane alone. You see, nursing in general has always been the paratroopers of healthcare. It just took a worldwide pandemic for the public to acknowledge it. Fast forward to the end of April. My GYN I had mentioned to you earlier, well, he remained in the ICU. He'd been prone, was experiencing ICU delirium, and had sustained a stroke due to COVID. Each shift I worked, I was hell-bent on keeping my hope for his recovery alive. It'd been over 40 days since he was admitted to our unit when I was walking by his room. His nurse came out and said, "Wendy, he just asked if that was you." I immediately went into his room, jumping into my spacesuit first, of course, and I heard his voice over the trach say, "Wendy Palma?" I knew he was back. I felt the tears fall from my eyes, and I sat and held his hand, and we cried together. Dr. Matthew Bashar was discharged from our unit May 4th. He continues his recovery and is doing well. We have a date for lunch on the unit this coming May 4th to celebrate. He's here in the audience tonight, and I couldn't be more grateful. This past year was clearly one of the toughest ones to date. And I was reminded of some pretty valuable things. First, the most important things in life, well, they're just not things. Second, this year solidified my passion for bedside nursing after 23 years. And lastly, but probably most importantly, always listen to your mom. Thank you.
Thanks so much, Wendy. What a great way to end this evening of stories. I wanted to ask you this flipping of roles and this support that you provided for this gentleman who'd been your physician. Have you had the chance to tell him this story between then and tonight, or is this the first time that he's hearing it?
I'm sorry, I was disconnected. What was the question, Neil?
The question is, had you had a chance to tell the story to that physician/patient about how you've shifted roles together, or is this the first opportunity?
It's the first time. I've texted him. We've talked. So we've had conversations, but this is the first time he's hearing this story.
Love it. Thank you so much. This speaks volumes about what we can do for each other and the power of venues like this. So thanks again for sharing and for closing things tonight, Wendy. Really appreciate it.
Thank you for the opportunity.
And that concludes my portion of the evening. I'd like to hand things back to my dear friend and collaborator, Marion Leary. Marion, what an evening.
Right? Oh my gosh. I am so proud of all of our storytellers. And did I tell you that these stories would make you laugh and they would make you cry? I was not joking around. I really hope all of you were inspired by these stories and just encouraged to do more. Nurses most definitely have the best stories, and I am so glad you are all here with us tonight to hear them. Nurses, please keep telling your stories. The world needs to hear them now more than ever. Before we close, I would just like to once again thank all of you for attending. I'd like to thank our storytellers for sharing their stories, our sponsor, Sandy and Joe Sandberg, Penn Nursing, Penn Medicine, and the Penn Biomedical Library, as well as First Person Arts and PWP Video for all of their help with this event tonight. This event would not have been possible without the help of many of my colleagues in our marketing and communications, as well as special events offices, so thank you to all of you, as well as my colleagues, Dr. Terry Richmond, Dr. Rosemary Palomano, Jesse Wright, Flory Vanek, Brandy Grant, and Christine Parkinson from Penn Medicine. I do want to just apologize to all those who were trying to get in and could not. We had a technical glitch this evening. We will be sharing this video widely as soon as it's available, so everyone will still be able to hear all of these incredible stories. And with that, keep sharing stories, stay safe, and have a good night, everyone. Thank you.